Our vision at IntraHealth is to create an environment where all people have basic access to healthcare services. We believe that health is a basic human need, and that is in fact the premise of all of our work.
The biggest challenge in global health today is the huge gap between the people who have health care and the people who don't.
Our mission at IntraHealth is to empower healthcare workers to better serve community and individuals around the world.
IntraHealth focuses on health workers because IntraHealth believes that health workers save lives.
When there's no health worker, there's no health care. And when there's no health care, it's generally the most vulnerable, women, children, who suffer.
Without health workers, there is no health. Health workers are central to the entire health systems framework.
A health worker to me is somebody who brings health and care and advice and information.
It's really the person who is at the front line, identifying the needs.
We definitely need champions to improve health outcomes.
I think a healthcare worker is someone who can accompany others, someone who can empathize.
It can be anybody who's doing anything towards health to alleviate suffering.
There have been a number of studies that have shown quite clearly that the health worker density ratio bears a direct correlation with the kind of coverage of health services that can be provided. There are 57 countries in the world that have fewer than 2.3 health workers per 1,000 population.
The global shortage of healthcare workers around the world is 4.2 million. We're going to meet that need by making sure that there are well-prepared and well-distributed healthcare workers everywhere.
If we are able to provide one additional health worker per 1,000 population, the impact of it can be really phenomenal. It can actually reduce up to 10 to 15% of the infectious disease burden in that particular community. More than 500,000 women die due to complications related to pregnancy or childbirth every year. And what this really translates into is that every minute there's a woman dying. Upper income countries, 95% of the births are attended by a skilled birth attendant, whereas in the low income countries, less than half, or about only 43% of the deliveries have a skilled birth attendant. A health worker intervention by saving one woman's life at time of delivery has a multiplying effect because it also helps the community. An estimated 200 million couples want family planning services but have no access to them. In 1 year, IntraHealth helped 100,000 people initiate contraceptive use. Most people living with HIV do not even know that they have the disease. But with IntraHealth's help, within 1 year, 500,000 people have access to counseling and testing, and they have now known their status.
El VIH es un virus de inmunodeficiencia humana que entra a nuestro cuerpo.
The solution to access to health care, I think, is access to health worker.
Strengthening of the health workforce, empowering health workers within the community would eliminate or greatly reduce this great disease burden.
It's important to get health workers where they're needed physically. It's also important to make sure to address broader issues of economic access so people can afford health services, and also to make sure that when the health workers are there, that they have the right skills and the right tools to be able to do their jobs and meet the needs that are there.
The production of health as a product, the production of better outcomes is facilitated, managed, and incorporated and provided by the health worker.
Healthcare workers are the essential link. By investing in the health workforce and the health workers, you are not just investing in the health of the population, but you're investing in the overall economic development. You are helping lift countries and communities out of poverty.
IntraHealth has a vision that all people have equal opportunity for health and well-being. We aspire to that vision by championing and advocating for a health worker who is well-placed, skilled, and motivated. When those health workers are in place, then communities can thrive, and ultimately the world is a better place.